Endometrial stromal sarcoma are a rare and quite heterogeneous group of gynecological tumor starting in the stroma cell of the uterus. They are rare tumor, but a subset of these rare tumor that are the high-grade stromal sarcoma are biologically extremely aggressive and therefore difficult to treat in the clinic. Surgery is really the only major procedure that can be curative in early stage disease in about 50% of the cases. But again, even in stage one, about 50% of this tumor may come back, return as recurrent tumor, and inexorably kill our patient. So that is why there was a dire need for us to try to identify new treatment modalities to deal with this tumor, in particular in the recurrent setting. Now, the difficult thing is that because they're quite rare tumor, it was not easy to put together a casuistic large enough to be able to draw statistically significant conclusion about the characteristic of the genetic profile of this tumor. That is why it took me several years to collect 80 samples with this characteristic, high grade for the majority, in part low grade, uterine sarcoma. And we were able again to collect such a significant number of specimen from different academic institutions in the US, several academic institutions in Italy, and this was really a worldwide collaboration because of South Korea participate actively in the genetic analysis of this sample. So the question that we had is, can we analyze this tumor in a comprehensive way to try to have a deeper knowledge and understanding about the genetic fingerprint using all genome sequencing, all exome sequencing, as well as RNA sequencing. So to look also to what is transcribed in RNA and potentially in protein in this tumor. And that is where, again, we started because to be able to design a personalized treatment modality, and this is true not only for high-grade stromal sarcoma, but for whole cancer in humans, you need to have a deep knowledge about the genetic characteristic of the disease. Because it's only when you acquire the type of deep knowledge in the molecular characteristic that you may really identify potential target that using, again, different strategies, small molecule inhibitor, antibodies, antibody drug conjugate, may affect the growth of the tumor because now you have somehow identified a potential Achilles heel of the tumor. Because when these mutations are in place and these are driver mutation, it means that the tumor is addicted to this specific pathway. And if you are able, with a small molecule inhibitor targeted treatment, to affect that pathway, we are usually able to see clinical responses in this patient and therefore either prolong their life or more rarely with immunotherapy, we have been able to do that, really cure this patient, even with advanced recurrent disease.